Is it possible to self-diagnose yourself using AI from home, completely bypassing the entire American health system, saving you thousands of dollars? That's what I tried to do. Turns out it's not that simple, but I still learned a much better way to navigate it. Studies have shown that AI can outperform doctors, especially on complex or rare issues in the area of diagnostic reasoning. A Stanford study found AI reaching 92% accuracy compared to doctors reaching only around 75% accuracy. So why go to the doctor when AI can already give you better answers to begin with? Around 10 years ago, I had an ice skating accident, and every once in a while, when I sit in a weird position with my neck tilted, I get this clear fluid leaking from my nose. It happens once every few years and it's super rare, but it still concerns me. 8 months ago, I was sitting watching a movie on my phone like this with my neck down, and it happened again. I went to AI and told it everything about my condition, and it suggested that what I may have is a cerebrospinal fluid leak, and that the proper test was checking if that fluid coming from my nose contained something called beta-2 transferrin. And it gave me the exact CPT code that I needed to check this. A CPT code is a 5-digit number that uniquely identifies the specific procedure or test that needs to be run. Labs and doctors pass the CPT code around to make sure that they exactly identify the exact thing that they need to perform. Now, the past 2 times that I went to the emergency room for this, I could never prove to doctors that I actually had this condition, and they played it off as rhinitis or some cold condition. So this time, I asked AI how I could collect the sample, and it guided me to go to CVS, get a sterile cup, and I collected the sample and I froze it in the freezer. With the CPT code from the AI, I now had to get this sample tested. So I called numerous labs directly. I called LabCorp, I called university hospitals in the area, I called other community hospitals in the area, and they all told me the same thing. You need to go get a doctor's prescription or we can't accept it. So I first tried Teladoc, and during the consultation after I paid for it, they told me they could only handle colds, blood tests, or simple things like this, but not what I had, not something complex. And they told me that I needed to go through my primary care provider, which I don't actually have. That was frustrating because I was trying to handle everything from home, and it was the weekend and a lot of the doctor's offices are closed. So I left Teladoc a 1-star review and went looking for another solution. If anybody knows a true remote doctor solution that we can use to get prescribed remotely from home without needing to go to a doctor's office, can you please let me know, and I'll pin it in the comments or send me a direct message so that we can help everyone else. So I went looking for another way to test the sample, which I already knew what lab needed to test it and what procedure needed to be done specifically onto it, and I didn't want to spend thousands of dollars, and eventually I found there's some community clinics that charge a lower fee, and if you've got a low income, you can go to these clinics and they usually have a sliding scale fee where if you don't have insurance, they'll help you anyway, even at 0 cost. So I went to one of these in Miami and they gave me the referral that I already knew that I needed. I did learn one thing though at the community clinic, which is the doctor showed me that there's this website called MD-Save. And what you can do with this is you can search by CPT code the different clinics that offer this, and you can sort it by cash cost. That means you can find the most affordable clinics nearby that offer tests for your specific procedure. And better yet, what you can do is you can then take the clinic name, look it up on Google Maps, and see the reviews. So let me summarize the process that I went through. First, talk to AI to figure out what your condition is. Second, go to a community healthcare center or go to a sliding scale clinic. So even if you can't afford it or if you don't have insurance, you still can get treated. And number 3, you are going to get a CPT code and a doctor's order, and you take that and you look it up on MD-Save and you look up by cost and find the lowest cost, highest reviewed clinic, and then you go to get the actual procedure taken care of, just what we needed in the first place. I'm not an expert here, but I hope this helps someone out there, and please pitch in the comments and tell me what I could improve, and maybe it helps other people as well. Take care.